Good afternoon and welcome to United TV. Today is Bariatric Friday, May 2nd, 2025. Dr. Isaias Irgau is going to join me from CHRIAS and American Surgery Center, and we have to make a little bit changes on our schedule based on my travel. So we have only one session today, but then we'll be back with our regular sessions later on. Today we are going to discuss two different critical aspects of bariatric journey, the essential roles of multivitamins and the impact of smoking and alcohol. Our goal with these sessions, these episodes, to get our patients ready for the surgery and also support them after the surgery. And what we also know is even without surgical interventions, I know there are a lot of others who are taking advantage of the sessions that we are providing, now being a licensed channel, healthcare license channel. I know it puts more responsibility on us, and I'm going to have Dr. Irgau to help me with this discussion today. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Glad to be back for yet another session. And this is, I guess, the first time we're doing it at 2 o'clock, right?
Right.
Yeah.
So we have done a couple of different times, but it's like 99% it's at 3 p.m.
Wonderful.
So,
wow. I'm glad we made it happen.
Well, thank you for joining us, and thank you for being flexible.
Of course.
So we are going to talk about, I kind of merge the two different topics. We normally would have them in two different sessions, but being able to provide them in one segment and for someone to really get what they need, this is actually three different parts of bariatric surgery: multivitamins, smoking, and alcohol. So vitamin and mineral deficiency is extremely important, not just for our patients, but for everyone, especially with depending on someone's gender, someone's age. The need is changing, the need is there, and then we have to really take advantage of what's available for us. But for our patients, because of the changes that we have throughout the process, this is even more important. So we want to actually have you helping us with these questions and tell us why the multivitamin is necessary after bariatric surgery.
Of course, of course. I actually think it's a good way to combine these topics. Essentially, there is a fundamental change in the anatomy after bariatric surgery, and that essentially dictates two important factors, right? There are things that if you don't do them, they will hurt you. Right. And there are things that if you do them, they will hurt you. And these are the two topics we're combining today, right? On the one hand, if you don't take vitamins, you will have consequences. On the other hand, if you continue smoking or drinking excessive alcohol, you will have consequences. And that's based essentially on the fact that there are important changes in the anatomy of the person after bariatric surgery. So starting from the vitamins issue, what we're saying is that because the stomach has been reduced in size after bariatric surgery, or because the intestine has been rerouted in its position after bariatric surgery, the body's ability to absorb as much of these essential nutrients like vitamins and other minerals is reduced. The body is not capable of taking on all the necessary nutrients from whatever the person eats in a normal way, which means that, yes, because you're not absorbing so much, you are not taking on calories and you're going to be losing weight, which is something that we want. But on the other hand, because you're not absorbing enough of these essential, what we call micronutrients, like the vitamins and the minerals, there are consequences to your health. So we have really the duty to educate our patients of these important facts, right? You have to take multivitamins. You have to take some essential vitamins on top of your multivitamins, like B12, like folate. And you have to take certain minerals as well, like calcium, and in some situations, additional iron as well. Because if you don't take them, the body will suffer. You may have problems with your bone density, right? The bones can become weak. You may have problems with certain tissues like your hair or your skin that become much weaker. You may have issues with your immunity. You may have issues with your nervous system as well. There could be damage to the nerves that sometimes could be irreversible. So it is extremely important for anybody planning to undergo bariatric surgery or who has undergone bariatric surgery to also know that it is critical for them to take vitamins afterwards.
Well, it's a really good way to support what our body needs, right? Depending on where we are now. I know Hazel is listening, and then before I go for overseas, I know she's going to get my B12, so this way I'm testing whether or not she's listening. So, but I do that once a month. I feel like I needed it, so it's actually working for me. But again, we are not, this is not as crucial as it is for our patients. Now, would it be okay to just taking something over the counter, or does it have to be specific that's instructed by our surgeons or our dietitians?
Well, there is an ideal situation and then an okay situation here, right? Ideally, patients should be taking vitamins that have been really structured specifically for bariatric patients. And these are reinforced compounds, essentially, that will have higher quantities, particularly of some of the vitamins that bariatric patients can be vulnerable of their deficiency, right? But if those vitamins are not readily available to the patients, then any multivitamin is fine. But then, in addition to that, there are certain substances they have to take. For instance, we want our patients to take calcium on a daily basis. We want our patients to take vitamin D on a daily basis on top of multivitamins. These are very, very important. But also, Kemal, the other important fact that goes along with this is that patients need to follow up with their bariatric practice in the long term, at least once a year. And one of the reasons we want them to do follow-up is for us to be able to do blood work so we can check where they are with the vitamins levels, right? We don't want patients to come to us when their vitamin deficiency is so obvious that they have physical deficiencies, either because they're breaking their bones or because they're losing their hair, or God forbid, because they're having some problems with their nervous system. These are the very, very end manifestations of extreme deficiency. We don't want that situation, right? We want patients really to come to us so that if there are some lowering of the levels of the vitamins, we can pick on those early, and then we can prescribe additional supplementation so that we can restore the availability of those substances in their bodies.
So now, in the case of the surgery, how soon can they start taking vitamins after the surgery?
So they should start really within the first couple of weeks after they've had surgery. And the reason I am saying a couple of weeks is because generally patients will need to focus on their hydration right after surgery, particularly if it is something like a sleeve gastrectomy or gastric bypass. We put them on a liquid diet, and their ability to take on a lot of fluid is limited in that early time. And we don't want them to be struggling because they have to take the vitamins at the same time as well. And some patients have a changed sense of taste and smell, and they may not be capable really to tolerate taking those supplements readily that early after surgery. So to make things easy, we tell them, look, wait maybe a week, 10 days or 2 weeks, and then after you're comfortable taking liquids without any problems, then you can take the vitamins as well. Remember, patients will need to be continuing to take their very important prescription medications. They may have medications for high blood pressure or for other conditions, for instance, that we want them to take. And we don't want this need for those medications to be competing with the vitamins that early and for them to have problems. So we tell them, wait a week or two before you start your vitamins.
So now, the way that I manage my daily vitamins, I have a medication box, the pill box. If I'm here in the central location at home, like every 7 days, there are 7 boxes. Like this week, as you may remember, I was in Kansas City, so then I didn't have to plan anything. I just took that box with me and I put it in my briefcase, so then I didn't have to worry about it. But when I came back, I realized that actually I used the last day, so now the box is empty, and then I wasn't the one who was filling them, so now it was kind of like inconvenient in a way that, hey, I wish it was ready. So then what happens if I didn't take it one or 2 days because either I was lazy or it wasn't available to me?
Right. Yeah.
What are the consequences?
So absolutely, the consequences would be that the deficiency will manifest itself in some type of problem in your body, essentially, right? So let's take, for instance, calcium. Calcium is important, right? Calcium is important because it's something that has many functions in our bodies, including strengthening our bones, right? And those functions will be affected if there is not enough. The same thing for vitamin D, for instance. And then particularly for bariatric patients, if you take something like B12, for instance, in a situation where somebody has had gastric bypass, well, B12 is really poorly absorbed from the food only when somebody who's had gastric bypass, right? Particularly because the normal stomach actually plays a role in enhancing the body's ability to absorb B12. So with the stomach being excluded to a great part after gastric bypass, the patient is really vulnerable to deficiency of B12. And if we don't have B12, Kemal, for a long period of time, we may develop nerve damage that is irreversible. Those are really serious consequences. So it is important for patients to understand that being diligent with your vitamin intake goes hand in hand with having bariatric surgery. In other words, you cannot have bariatric surgery and forget about vitamins. Bariatric surgery is
especially in the case of bypass.
Absolutely.
So because there's very little food intake, so that's definitely.
And also because the intestine has been bypassed in such a manner that the portion of intestine that is good at absorbing the substances is not in contact with food any longer.
There.
Yeah.
Right. Well, the way that I see these are preventive issues, and then if we know what we need to do, when we start the procedure, like the actual consult, first time we see the patient, we do the blood work, and then we check certain values, and one of them is hemoglobin. And knowing that number is low, we know that patient may have a couple different issues. One of them is an iron deficiency, and we go into the details based on their age and their gender. There may be specific reasons for that. Now, but in many cases, we know that they are not being taken care of, or they are not even aware of those issues.
Yes.
And like for someone to have a hemoglobin problem, low hemoglobin, they don't need to lose 2 tons of blood, so they just need to lose some blood.
Right.
And this can be even true for patients with the hemorrhoid problems. That if it's a daily, they have an issue with hemorrhoid on a daily basis, even that type of blood loss can create a lot of problems.
Absolutely.
But then fix is easy.
Yes.
So, and that's why we are actually trying to highlight these. And I sometimes hear from our patients, like, well, this one actually doesn't work for me, it upsets my stomach. And the easiest way is to talk to either our nutritionists or our surgeons when they see us. So then there are different forms of these vitamins, and some of them are chewable, some of them are in the liquid form, and even there are some patch vitamins available. So then, but not taking it should not be an option. So, and one other thing that I want to mention, Dr. Irgau, you have mentioned this in several other sessions with vitamin. So like people always have this misperception in their mind. Well, I'm eating healthy and I'm going to get my vitamin from what I eat. And that's not true. That is like we don't have that freshness from what we eat. That's not available. By the time the food comes to us, that already processed so many times and so much time is gone. So then that's no longer an option. If we were just sitting in the field, in the farm, and then eating it directly from the farm, that would be one thing. But that's not what it is today.
Absolutely. So modern life has changed really our setup so much that it is critical for us to pay attention to this. One issue I do want to mention, Kemal, that comes up from time to time is that I hear some people being reluctant to have bariatric surgery when it's absolutely necessary for them because they say, oh, I don't want to have to take vitamins for the rest of my life. Well, look, as you mentioned, yes, exactly.
And everyone who talks to me, they are forced to take it because I tell them that they have to take vitamins.
Absolutely. And that's the point, essentially, is that if you are living in modern America, right, a highly technological society where you don't have access to fresh fruit in your backyard on a daily basis, you must take these micronutrients for you to stay healthy. So that it's just not a choice. So not to go for bariatric surgery because you don't want to have to take this medication is to forget that these medications are actually necessary even without bariatric surgery.
The reason I'm smiling is because right now, like with the travel coming up, one of my luggage, half of it is like a vitamin store. And that's for the family members and friends who need it.
That's a good service. That's a good service, yeah.
This has nothing to do with the surgery itself.
Absolutely.
But after certain time, certain age, how we are actually getting ready for those new journey of our lives. We all have some form of this happening. Now I want to switch gears to our other topics between smoking and alcohol, and we'll start with smoking. Many people don't understand why smoking would have impact on the surgery itself and pre and post, and when they need to stop, and there's a lot of information that's either not available to them. Of course, when they start with us, it becomes available. But then if they're not, then they may not understand. But if we can actually start with why patients stop smoking before the bariatric surgery, what is the reason for that?
So the reason is twofold. First of all, the surgery itself will have a much higher chance for complication if the patient is a smoker, an active smoker, while we do the surgery. So that's why we say we're not going to do it. It's an elective surgery, and we want you to be prepared for a surgery that will have lowered any chance of complications to its lowest level possible. Right? And stopping smoking is an easy pick for us when we know that smoking is such a dangerous thing for a person preparing for elective surgery. The second reason is that afterwards, after bariatric surgery, particularly with certain procedures like gastric bypass, actually smoking will put that person in serious danger, right? One of them is, for instance, is the occurrence of ulcers where we reattach the intestine to the stomach. It's called anastomosis. It's a artificial connection that we make during surgery between the intestine and the stomach. And that connection is vulnerable to formation of ulcers. Ulcers are like a little wound that can occur in that area. But that wound is much more likely to occur if the person is actively smoking. That wound is much less likely to heal with medication if the person is actively smoking. That wound is going to be prone to serious consequences like perforation or bleeding that are life-threatening events if a person is an active smoker, right? So we really are very serious about this issue. Now,
one thing, like, does the patient have the same type of risk when they have gallbladder surgery if they're a smoker?
As far as anesthesia is concerned, yes, they do. So, but very often if a patient is coming for gallbladder surgery, there is some urgency in undergoing.
If it's on the urgent setup,
you have to go ahead with the surgery, and it's very difficult. But with bariatric surgery, we do have time for preparing the patients. And also, remember, we want the best outcome for our patients. And when we are advocating for them to undergo surgery in order to fix a chronic problem like obesity, we want to also educate them about what are the best ways for them to have the lowest level of complication possible. Now, it is a conversation that we undertake with the patients upfront when we first get through the consultation. And the good news, Kemal, is that the vast majority of patients are actually people who have tried to stop smoking. They know smoking is bad for them. So these are not people who are just smoking regardless. It's people who really try. And stopping smoking is an extremely difficult endeavor for most of them. But the good news is that at the time of surgery, once they make up their mind, they can be so much more focused towards that intent that the success rate is actually fairly high, I'm very happy to say. We have patients who come to us with 2 life-threatening risk factors for their health, obesity and smoking. And in one stroke, we're able to get rid of both of them, really transforming the path of health of that person radically. A person who would have had their life expectancy counted in a few years because of obesity and smoking, now they can extend it tremendously because they've gotten rid of these 2 serious risk factors. So we win really in a big way when we are able to get patients to be off smoking before bariatric surgery.
Smoking, as you mentioned, it has a lot of other harms in the body, like sleep apnea. We didn't even mention. It's a huge problem. Many people don't even know that they have it.
Absolutely.
But if they're a smoker, and then if they have morbid obesity, it's even it becomes more complicated. Same thing with heart disease. That's a huge problem, and for so many other things. So it shouldn't even be discussed at this point when we know that we are going to be able to hit so many issues at the same time. Now, how long do they have to stop before the surgery? What's that time frame?
The time frame really is 6 weeks before surgery. If they can stop earlier, that is better, but 6 weeks is what we're looking for.
All right. And our care coordinators, they do provide smoking cessation and any help that they may need throughout that process. And I don't know when we had an issue last time with this.
No. I think we've been very successful with this. I think
one of the things that we are discussing these things because these are kind of like potentially identified risk factors, and then we are covering these. But how many times these become a problem that stops the procedure?
Yeah.
I don't remember any.
Me neither. And I'm very proud of our program for that purpose because this is a critical issue at all steps through the preparation, and everybody makes sure that they're focused on it. And we've been successful to a great extent, actually.
So we'll go to the alcohol issue. And is alcohol still safe after the bariatric surgery?
So that is a yes with some qualification, right? And what are the qualifications? Well, it is important for people to know that their tolerance for alcohol is very, very different after bariatric surgery because they have a much smaller stomach, because potentially they have rerouting of the intestine. A much smaller quantity of alcohol will have a much bigger effect after bariatric surgery, right? So it takes much less alcohol for them to actually become drunk, right, to begin with. The alcohol level stays up in their body for much longer afterwards, which means that the risks of alcohol are going to be much enhanced after bariatric surgery because the body is not as tolerant to alcohol as it would have been before bariatric surgery, right? Now, I tell my patients to really not have any alcohol at all for 6 months after surgery. Try to tell them that. And there are situations in which I actually ask for patients to give up alcohol completely as well. And these are situations in which I know that the patient has a history of alcohol dependence before, right? If they have that history, they are going to be vulnerable to go back into that situation for 2 reasons, Kemal. One is obviously because the risk stays with them, but 2 is because if the patient is under stress and if they were utilizing food as a form of comfort during emotional stress, and because they cannot eat very much now, it's much, much easier for them to go and grab alcohol as an alternative. And there have been situations in which people have flipped their situation in this way, and they have become alcohol dependent, which is a tragedy after bariatric surgery, because the dangers of alcohol are so much higher after bariatric surgery. And I've mentioned, obviously, the fact that people become drunk quickly, that the alcohol level stays up. But the other thing I did not mention is that the damage to the liver can occur much more quickly after bariatric surgery than it would have been otherwise. So patients can end up actually in liver failure if they are not careful. So there are real dangers, and these are discussions that are very important. And as I said, if alcohol was not a problem for the person beforehand, I would say, okay, don't drink any alcohol for so many months after bariatric surgery, and then afterwards in moderation. If you were able to drink 2 drinks in the past, now it's going to be half a dose afterwards. Be very careful. And with that moderation in mind, patients will do fine. The other aspect, of course, that we have to consider, Kemal, is that we're doing this surgery to decrease the caloric intake of patients. And when they take alcohol, actually, they will be taking empty calories, right? That will be an obstacle to their weight loss journey. But also, as we know, alcohol also acts as an appetizer, so people will be much hungrier if they continue to drink alcohol. So their ability actually to lose weight might be hampered by this fact as well. So all these discussions are important. Of course, distinction is important. Smoking is a no-no completely, but alcohol, that's why I said it is a qualified yes when we talk about alcohol after bariatric surgery.
Underlying issue is if we have some type of addiction problem because eating disorder in some format or form of that, it's part of the underlying issue of the addiction. So then if we are transferring this, now we take care of this, but then now we are, without fixing the main issue on the alcohol or the smoking, even switching that to a different focus. So even some people, they can become newly addictive because the addiction is the main issue, right?
Absolutely.
So that's why we also have a site clearance before the surgery, and also even our nutritionists, when they are available after the surgery, one of the reasons is not just the nutrition help, but anything at any point they may need more help. We have our social workers, we have our entire team available. Now, do you believe patients should be routinely screened for alcohol and tobacco use pre-post surgery?
I think yes, in a way we do that, right? The screening obviously is the one that we do during our interaction with our patients, meaning that, of course, we want to delve a little bit more deeply into this aspect of their social history, right? So the smoking, of course, and then the alcohol, we will, of course, Kemal, if I'm asking a patient if they are smoking and they say they're not, but I look at their fingers and they're stained with tobacco, I come close to them and they're smelling of smoking, then I will have to question the integrity of that, and I will have to say to them, look, we have to really have an open discussion about this. This is important. So we're not going to the extent of testing them, blood tests and things like that, but we have to have really a very transparent discussion on this. These are not issues that we can overlook when we are screening patients and preparing them for bariatric surgery.
Sure. So our goal today was to kind of provide additional information, some base information and some additional information on these 3 different issues that we discussed. A couple of statistics that I can provide. Smoking quadruples the risk of marginal ulcer after gastric bypass. And the one of the JAMA surgery studies show that alcohol use disorder doubled in patients 2 years after surgery if they're not being handled ahead of time. So that's why we are recommending and requiring our patients to complete the smoking cessation.
Absolutely.
And strong caution of avoidance of alcohol, and that's also part of this goal of this session. So we can provide this information readily available for them. Next 2 weeks, we won't have live events, but we'll have our premieres that we'll be covering. And then on May 23rd, we'll be back with live.
Yep.
And today, our goal, again, is to handle these obstacles that we may have throughout the process. The journey that we are providing for our patients and being part of what they have to go through, we want to make sure that we do that at the best level. And knowledge is the key, and providing that readily available and making it available everywhere, not just the live event, but even after this, it will be available. So that's all we have for today.
We've covered a lot.
We covered a lot, but because it's in different segments and we have done several different episodes, if you believe that you need more help other than talking to your providers, please watch the other episodes, because we provided maybe some more background on different issues. So staying informed is the key, and that's why we are here. Thank you for being with us, and stay united.
Stay united. Thank you.